Right now, we'll start. And this is Pat Buxengard with Career Force. I want to welcome you all to the Rochester, Winona area virtual healthcare career fair. We will start with some basic housekeeping information. In the chat box where you will find the link to the attendance form, and please just click on that link and complete the short form so we can record your attendance for in minnesotaworks.net. And then I'd like to introduce my co-producers are Liz Jennings, Marlene Lundberg, Linda Arnoldy, and Autumn Herber from DEED, and they will assist in monitoring the chat box today. I would like to welcome our employers today. So probably the next slide, please. Now, did it move? So today we have Sauer Healthcare, Spring Valley Living, Volunteers of America, the Homestead at Rochester and Rochester Rehabilitation and Living Center, Hiawatha Homes, Rochester, Charter House, Mayo Clinic, Retirement Living, and Winona Health. To start us off, I would like to introduce Annie Rupert from Sauer Healthcare. Go ahead.
Thanks, Pat. So I think for everyone joining, I really appreciate you kind of putting this together for us, Pat. I think healthcare is a fantastic opportunity. For those of you who are considering healthcare as a kind of a switch in career options, I can't say enough about this. I've worked in a lot of different fields, manufacturing, other nonprofits, retail, and really something unique about healthcare after having been in this field for 3 years is that there's certainly job security, a lot of that, and there's a really great opportunity to grow a career in the healthcare field. So you can start at zero and you can just keep taking steps almost infinitely. There's a lot of different ways to kind of grow in healthcare. And so I think starting in even as a CNA is just a really great choice and a good opportunity for folks who are kind of considering a new pathway. Our facility is a smaller facility here in Winona. We're 71 beds, so we typically have about 100 employees total. For our residents, there's no segregation. So in a lot of facilities, you might have certain areas that are locked for memory care, or some are assisted living and some are in different stages of their care, but ours are all together. We do have on-site therapies. So we have occupational and physical therapy and speech therapies. And then we also take a lot of short-term respite stays after surgeries and things like that. Some unique things that we really try to foster in our facility is we love to help people grow in their careers here. So just this year we have, one more back, please, Pat. You see our dietary crew is there. We had 2 of those gals promoted up to cook. We also had 2 folks out of our dietary get their CNA and kind of move over to the nursing department. We've had a lot of our CNAs will take additional education and then they'll be promoted to a TMA, which is kind of passing medications. And then from there, you can become an LPN. That takes about 18 months. And you can do that. You can earn while you learn. You can be employed full-time and become a successful LPN. And then finally, in addition to that, we have 12 student CNAs who are in school to either be an LPN or RN. And they're receiving $3,000 a semester through the Minnesota Department of Education and the dual training grant. And so we do have opportunities for another 8 new employees to take advantage of that in this spring semester. So I'd love to talk to anybody who's looking for both an opportunity for employment and an opportunity for some education. We can kind of connect on that and I can answer any questions you might have about that program. Another really unique feature about our facility is because we're small, we have a really accessible management team. So I know myself, our administrator, our DON, and know all 100 of our employees by name. And it's something that's really important to us to know who you are so that everyone can be successful together. Okay, if you can take us forward then, Pat. Okay, and so some of the current and upcoming opportunities we have in our facility, we do have opportunities to be a full-time CNA. We work straight 8s in our facility. So certainly if you're interested in needing that full-time employment, we can get you started in that right away. We also have part-time student CNA schedules available as well. Our scheduler works really, really hard with our students who are going towards their nursing degrees. During the semester, we'll make sure that we can accommodate. So rather than the full 8-hour shift, if you need to start a little bit later because of a lab or a class, we can work with you on that. And then we can kind of move your point status up and down. So when the academic semester is in session, you may work less hours, but then during those breaks, you may work more hours when you have that opportunity to make some money. We also are going to be looking for somebody who has some experience in Medicare billing. So that's more of an accounting role, and it does take some actual specific experience. But if that happens to be one of people in our audience, I'd love to talk to you more about that. And then coming up in the future, probably just after the turn of the year, we'll have a full-time management position as a dietary director. And really any background and maybe in restaurant management, or food service would be really applicable in that role. We have online application. Just stop out and visit our website, and it's easy to click through and take care of that in about a half hour. And if you can move us forward. All right. So this gal here, Amanda, is one of our great success stories. She is started out with us in our dietary team, and now she is a full-time CNA, and she's working on actually becoming a pastoral services. So she wants to continue to work in long-term care, but as a pastor. So we're really lucky to have her on our team, and she's a great CNA and a great success story for us. You can see a lot of pictures about our different success stories. We love to celebrate our staff and our residents, the fun we have on Facebook. So feel free to visit us there. Certainly, you can also stop at our website. We've got all our job descriptions online there. And then all our contact information is there as well. So if you are starting from scratch and you need to get your CNA certification, we can help you get set up with those courses. If you want information on how our benefits work, or more information about that grant opportunity, all things, feel free to give us a call or drop us an email, and we'll be happy to work with you on those. And then I think our last slide. So that is my counterpart. The other half of the HR department is Jeremy, and he works almost exclusively with our new applicants and doing our pre-employment and orientations. And then myself, I'm happy to help you as well. We're here in the office Monday through Friday. And that's all I've got, Pat. If you've got questions, I can handle those. Otherwise, we're really glad that you put this together for us.
Are we seeing any questions in the chat box? Do not see any right at this time. I was wondering, like, what are the types of benefits that your company does offer?
Sure. So we offer benefits if you're a 0.6 or above. So that's working 6 8-hour shifts in a 2-week pay period. We have health, dental, long and short-term disability. We have a 401k for retirement planning. And then we've also got accident and critical illness insurances. And then we have sick time that starts accruing immediately upon hire. And then we've got vacation that accrues and becomes available on your first anniversary.
Those are good benefits.
Yeah.
Yeah, absolutely. And do you hire high school students right now for any specific positions or?
So you do have to be 18 to work in our nursing department, but you can be 16 and work in our therapeutic rep department or in our dietary department. And so we've had quite a few students who are under 18 that will start out in one of those departments and then get their CNA and move to nursing as they're entering their senior year or heading into college.
Awesome. All righty. Does anybody else have a question? Okay, well, thank you, Annie. I appreciate your input today.
There is a question in the chat about training and CNA certification.
So those certifications are reimbursed. So the cost of the course and the test are reimbursed to you after you've been employed for 90 days. We do not, we have you get on the registry first, and then we go through orientation and train you on the floor here at Sauer. The exception to that would be if you are already in a different department. So if you're already working in dietary or therapeutic rec, then you could work while you're getting your course. But the course takes 2 weeks to get, so it's pretty quick. And like I said, that full cost is reimbursed to you.
That was a great question.
Good question. Yeah.
All righty, and moving on. Next, I would like to introduce Amanda Blaney from Spring Valley Living. Amanda?
All right.
Okay.
Well,
There you are.
yes. Sorry about that.
That's okay.
These virtual meetings.
Yes, absolutely.
So I just want to thank you guys for allowing us to participate. This is our first virtual career fair that we have been in. So very exciting opportunity, and we'll see how things shake out. As Pat mentioned, my name is Amanda. I'm the HR director at Spring Valley Living. First, I'd just like to start out with a brief explanation. We are, of course, located in Spring Valley, Minnesota. For those that aren't familiar with our location, we're about 20-25 minutes south of Rochester. We are a small, standalone nonprofit healthcare organization, and we offer a variety of senior housing and aging services for our community and our surrounding communities. So we can move to the next slide, please. Our mission here is quite straightforward. It's to enrich the lives of those we serve. You can see by our little chart here, we do provide a variety of living options, therapy, both inpatient and outpatient, home care services, and then new to our campus coming within the next month or so is going to be adult day services, as well as a memory care unit attached to our housing with services building. So we do have kind of your general benefits package for all of our employees that work 30 hours or more per week. Health insurance, life, and dental are paid for by the facility. We have a generous PTO plan that starts accruing upon hire and is available for use after 6 months. And then we do also have an EAP program and continuing education and scholarship opportunities for our employees. One thing that we have started within the last year is we do now offer the CNA training on site through OnTrack. So we're able to provide that for, new employees coming in that don't have their certification or existing employees that want to move up into nursing. We'll continue, please. We do have several openings right now in a variety of departments, as you can see, and we do hire anyone from high school students all the way to retired individuals that are just looking for a few hours here and there. Most of our positions here are entry level right now and do not require any previous experience. As I mentioned, we do have that OnTrack program for the CNA training. So we do, have that available to anybody interested in looking into more of a direct care position. We do encourage professional growth. amongst our employees. And right now, our team of nursing administration is actually our biggest success story. Every single one of our nursing managers has gotten their start with us while they were in high school in other departments. We had some that started in dietary, some that worked as universal workers in our housing with services department, and others as housekeepers. So it's very, we have a young nursing administration, but we are very proud of them. So here I have my contact information. We do have an online application you can fill out at springvalleyliving.org/careers. Or you can feel free to contact me. This is my direct phone number at the office here, and I am available Monday through Friday.
Thank you, Amanda. That on-track program is really a nice opportunity for people. Do you find that a lot of your employees participate in that?
Yes, we actually, we have 4 individuals enrolled in that right now with us.
Okay.
We're doing classes, it seems, kind of all of the time.
Awesome.
I do see another question, scholarships. Yes, we do offer scholarships. We've actually got several employees on our scholarships right now. We're able to, kind of look at the amount based on the number of applications for scholarships that we receive. But right now, we're contributing a significant portion to our employees that are continuing their education. We've actually got some that are, enrolled to become nurses, and we do also have one that is exploring a career in gerontology. So not, still involved in our facility, but not, what you typically see with becoming a nurse.
And you frequently see career changers in their 40s or older?
Yes, we do. Actually, right now in our housing with services department, I have 2 individuals. One was a administrative assistant for the majority of her career, and for whatever other reasons that company ended up going out of business, and she had come to an open interview event that we were having. This was a year ago, pre-COVID, and just thought she wanted to get to know a little bit more about Spring Valley Living and what opportunities we have. We offered her a position, and she is now one of our universal workers. So she's helping our tenants that live within the apartments with meal service, housekeeping, personal cares, things like that. And she actually just said the other day, this is not something that she ever thought she would have seen herself working in, but she loves this career. Another one that we have she's a retired seamstress. She has done alterations all of her life, and just wanted to try something else out. And they both have been with us for just over a year.
Thank you. I appreciate that and sharing that with us. Any other questions for Amanda at this point? All right. Thank you, Amanda.
Thanks so much.
Our next presenter is Whitney Clapper, Volunteers of America, the Homestead at Rochester and Rochester Rehabilitation and Living Center. Whitney, you're on.
Hi, guys. Thanks for letting me join you today. I greatly appreciate it. So I am the talent acquisition representative as well as HR assistant for the Homestead at Rochester and Rochester Rehabilitation and Living Center. We are a large facility in Rochester off of 55th Street. We have about 280 employees or so. We're quite large. And we have 4 beautiful buildings on our property alone, as well as a pond right in the middle of the property for our residents to enjoy. So we are excited to get going. Who we are and what makes us different. You know, we are a nonprofit, faith-based organization. We have about 16,000 paid professional employees. And we are now for 2020 considered a great place to work certified. We were nominated by our very own employees, sent out surveys through the state and government does that. And we do not do anything special for our employees to fill out these surveys. They get to fill them out voluntarily on their own. And if you have over 80%, you are considered a great place to work certified. So our employees are very happy to work here, and we are very happy to have that title as well. What we can offer you to set us aside from other work facilities in the area, a diverse work culture, of course, nurse block scheduling for easy schedules. We do block schedules every 2-week schedules, so you consistently work the same days of week 1 as you would work different days on week 2, and then you'd go back to week 1. So it's very consistent. You know which days you have off, so you can plan well in advance for anything that would come up that would be needed ahead of that. We offer monthly VOA days to celebrate you as an employee, whether that is we buy each employee a lunchbox, whether we have yogurt parfait bars, we've had ice cream sundae buffets, we celebrate with just a pizza day, we've bought employee shirts so that they can wear, you know, like a great place to work certified shirt, but we have monthly VOA days to be able to recognize our employees. We have, it's actually 6 paid holidays for full-time employees. I do apologize for that, not 3, but 6. We have competitive wage and excellent bonuses. We actually just increases our wage scale. So we are now considered one of the top paid facilities in the Rochester area. So our competitive wages, again, have increased. We do offer bonuses as well for LPNs and RNs that are paid out quarterly. We do have referral bonuses. If you are an employee and you bring on a new employee, we do have referral bonuses. So bringing in friends and families, anybody that you can think of, each person will give you a referral bonus. So it's easy cash in your pocket. Our sign-up bonuses for RNs and LPNs, and RN is $4,000 for full-time and $2,000 for part-time. And our LPNs is $2,500 for full-time and $1,500 for part-time. Easy cash just for signing on with us. That is our facility that is pretty up to date and current. You can see the pond in the background as well. Right on the other side of the pond, we have a brand new facility. It is our assisted living and memory care facility. It is brand new. And so we are pretty proud of that. So again, that's what the whole main part of the building, which is our assisted living. To the right, you would have our long-term care facility outside of that picture. To the left is another building that is our independent living building. And again, on the other side of that pond in the very back is our assisted living and memory care support. We really love our employee and resident family quotes. We don't ask for anything. We get emails or we get cards in the mail. We get personal gratification face to face. And these are just some of my favorite ones. My favorite part about working here is the residents. We talk. They're so happy to see me. I'm proud to work here. It's like my dream. From a resident's daughter, Mom's very happy here. Her words are always, these are the nicest people. Another one, I have one resident I play chess with because he loves it and I can't find someone to play with. Last one, my favorite part about working here is the residents. We talk, they're so happy to see me. I'm proud to work here. So, you know, just a couple things. I know that we get these on a monthly basis. We have things that are coming in. I do 30, 60, and 90-day catch-ups with each employee on the floor. I actually go on the floor and I ask them, what can I do for you? How's your training? How can I help it? And how can I further your career with VOA? So we put a lot of work into our employees and we give them a lot of gratification. So we have insurance, of course. We offer insurance through Cigna, health, dental, and vision, including flexible spending accounts, dependent care accounts. We have 3 tiers, so we have something to fit every family's budget. If you don't want any benefits, because you do have your own benefits, we offer a comprehensive wage increase by declining benefits. If you're a full-time employee and wish to not have benefits, we give you a 17% pay increase. For some people, that's a make or break situation for their family. So, and if you're part-time, it can be anywhere between a 13 and a 10% pay increase. So lots of opportunities. If you need benefits or don't need benefits, we have that tier program and something for everybody. On current open positions, we have certified nursing assistants, home health aides, LPNs, and RNs. We actually added to the list this morning housekeeping supervisor, which is new, just looking for more of a leader role and somebody that's willing to get on the floor, and then full-time and part-time housekeepers. And then we added now, because of COVID, a hospitality assistant, somebody that can sit at a desk near the front door and assist with a health screening questionnaire and temperatures. We're looking for part-time hours in the evenings for that and on the weekends as well, so that we can monitor more of our COVID intake. I'm also happy to announce real quick that the Homestead at Rochester, Rochester Rehabilitation and Living Center, we have currently 0 employees that have tested positive for COVID-19. We had 1 that was PRN, and we've had 0 residents. So since March, we have taken this 100% serious. We're taking every single precaution we can for our employees and for our residents to keep everybody safe and healthy. That is our link if you'd like to join our amazing team, www.careerswithvoa.org. Whitney, that is myself. You can contact me. I am also open. If you have any questions, concerns, or would like to just apply simply by coming in and meeting with me, I am okay with that, or Zoom. My phone number is there. Call or text, or email is also easy as well to be reached at.
Thank you, Whitney.
Absolutely.
Congratulations on that Great Place to Work designation. That's pretty cool.
Thank you.
And do you also hire some 16 and 17-year-olds for different positions?
We do, yes. Yep. So our housekeeping roles, anything not clinical, we're able to hire under 18. If it is, if you're wanting to get in the clinical aspect, we do have you be 17, turning 18 soon, or being 18. We do offer scholarships and tuition reimbursements. Speaking of tuition reimbursements, I was interested in getting more into like an HR career and learning more about HR. And I applied for a scholarship. It took less than 24 hours. They got back to me and granted me with a $5,000 scholarship to continue education at U of M. Went online and signed up for classes right away with $5,000 check that they'd mailed me within a week. So lots of opportunities for career advancement or scholarships and tuition reimbursement.
Very nice. So can you explain the Volunteers of America Homestead of Rochester connection?
Sure.
Like how it's connected?
So it's an entity. So Volunteers of America is the large organization with 16,000 paid employees. Underneath that umbrella falls the Homestead at Rochester and Rochester Rehabilitation and Living Center. So we have a bunch of entities underneath the Volunteers of America umbrella that are all over the United States.
All right.
So it is nice for those that are wanting to transfer. We do have some in the cities. We have some in North Carolina. We have some in Florida. We have some in Colorado. We have some in California. So, we're all over the U.S. and it's a pretty easy transfer process too for those that are wanting to kind of up and move to another location.
Wow, that's awesome. Very cool. Any other questions for Whitney at this time? All right. Thanks so much, Whitney.
Thank you.
Next in our lineup is Abby Bumstead from Hiawatha Homes. Abby?
Hi, it's Abby Bumstead. That's me. I'm the recruitment and onboarding representative here at Hiawatha Homes. I also have Stephanie Lacqua, who is a program director here at Hiawatha Homes. If you want to say hi, Stephanie.
Hello.
Yeah, so I thought it would be a good idea to kind of have the both of us on this presentation, as I'm fairly new to Hiawatha Homes, but I have all the information regarding our open positions, and Stephanie Lacqua has more of the history for Hiawatha Homes. So if you want to go to the next slide. So just to give you an idea about Hiawatha and our mission and our vision and our values, I think you have to hit enter a couple times for them to pop up. There we go. So our mission is to provide quality support services to people with disabilities at home and in the community. And our vision is the people we support are living a fulfilling life of their choice in a community that values and includes them. Our values are advocacy, choice, innovation, respect, and relationships. And those are some wonderful pictures of some of the individuals that we support on the side as well. And so if you want to go to the next slide as well, the people that we support here are children, adults, and families with developmental disabilities, physical impairments, brain injury, specialized medical needs, limited mental health issues, autism spectrum disorder, and other health disabilities. We are dedicated to providing person-driven support services to individuals and families, and quality support services will be delivered with dignity and respect for each person and his or her unique needs. So then looking at our career opportunities, we have a wide range of career opportunities available here at Hiawatha, going from entry level all the way up to professional level. So starting with our entry level position, we have the direct support professional position. We also have direct support aide and direct support tech positions. The direct support aide position is primarily for people who are 17 and turning 18 within 60 days, whereas the direct support tech position would be a non-passing, med-passing position. So you would have a little less responsibilities and duties with that type of position. But our main position is a direct support professional position, and we start at $13 an hour. We also offer shift differential payments of $2.50 an hour, as well as $2 an hour for late nights. And then going up from there, we have our team leader position, which I would classify as an associate level position. Usually our team leaders have some primary or previous experience with direct support care. And so the starting pay with that would be $15 an hour. And we also offer the shift differentials for weekends and late nights for that position as well. Then we have our house coordinator position, and the house coordinator would oversee one entire program, which is usually about 3 to 4 individuals in that program. The pay for that position is based on experience and education, and we also offer shift differentials for weekends and late nights on that position as well. Then kind of moving to our nursing positions, we have our house nurse position, and so we have house nurses who are either registered nurses or licensed practitioner nurses. Depending on if you would be an RN or an LPN, you get $29 an hour for an RN position and $22.50 an hour for an LPN position at the starting pay. We also offer shift differentials for weekends for our house nurses, depending on the specific program that you'd be working at. And then the minimum job requirement for that position would be either a current RN or LPN license in the state of Minnesota. And then lastly, for a professional position that we have available right now, we have our assistant nursing director position, and the pay for this position is based on experience and education. The current requirements that we have for this position is that you must have a current RN license in the state of Minnesota, as well as nursing experience in the field of disabilities, and previous leadership experience is preferred. So going to our next few slides are going to be some team member stories that we have here at Hiawatha, and I'll let Stephanie take it away.
Yeah, so just a couple of our most recent ones. We recently had a couple of our direct support professionals who were recognized by ARM as being heroes and being a part of the national DSP promotion that they've been working on. The first one you're going to see is Cindy. Cindy has had a long time connection to Hiawatha. Her father lived with us for many years. She kind of went through a phase in life where she really wasn't sure what she wanted to do, which eventually landed her here with us after seeing the support that her father received. And she is always just sharing with us about how enjoyable her job is and how much she feels needed and how she feels so grateful, and her heart is just so full when she gets to spend time with people she supports. We also have Joe. Joe is another one who last year was nominated as our ARM DSP for the state. He has been with us about 5 years. We have supported him through becoming a citizen. while he was been working with us. So he has been with us for almost 5 years and has recently actually just taken a promotion from a DSP to a house coordinator. So he will be joining our leadership team. He is a very dedicated, very heartfelt man who will greatly share with you how much he loves coming to work every day. So there are lots of opportunities for growth. We are really, really being strong promoters of promoting within and helping the staff that we have find their career path in life and find what they want. So we have lots of people who have started as DSPs who have then moved up to become team leaders. Recently, we just brought on 2 team leaders as house coordinators. We have a staff who started with us as a 17-year-old in our family support services program as a DSP, who is going to be joining our nursing team as soon as his boards are finalized. So lots of room for growth. We have house coordinators that are now have moved up to the management team as program directors. So there's definitely lots and lots of growth, and we definitely try to promote that and help people find their career path and find what they enjoy doing.
Awesome. Thank you for bringing that insight, Stephanie. If you're interested in any of our positions, you can go to our website at hiawathahomes.org, and you can fill out an application directly from there. Otherwise, the first slide also had my personal email as well as my personal phone number as well. So if you needed to contact me for any questions that you had about positions, you can go ahead and contact me there as well.
I'm unmute myself. Sorry. Any questions
That's okay.
for Abby? Do you have a recommendation? I know that when people do actually apply for positions, if you invite them in for interviews, what are some of the qualities you might be looking for in people that actually are interviewing with you?
Yeah, so specific qualities that I always look for when I'm interviewing an applicant is someone who is passionate and driven to be in the healthcare community. We want people who are going to support individuals with a caring heart. This isn't necessarily going to be something that you just clock in and clock out and get your paycheck. This is going to be a bigger scheme of things. Once you join Hiawatha Homes, it really becomes your family. And I've already felt that just with being here the few months that I have. So I really look for people who are passionate and just have that drive to be here.
Thank you. Appreciate both of you participating, Stephanie and Abby.
Yeah.
All righty. So at this time, I'd like to introduce Laura Swenson from Charter House Mayo Clinic Retirement Living.
Real quick before, there was another question in the chat box about if those are individual homes.
Yes, so we currently support 78 individuals who are spread out amongst Rochester and a couple of homes in Orinoco. So every house, depending upon the house, there's like 3 to 4 individuals that live in each house.
Perfect, thank you. All righty, now I'd like to introduce Laura Swenson from Charter House Mayo Clinic Retirement Living.
Hello, everybody. Thank you for joining in today. Thank you to Pat and team for coordinating this event. It's unusual times to be doing virtual career fairs. We'd love to see you in person, but we're really glad you're tuned in today. So I'm here to talk a little bit about Charter House. Charter House is Mayo Clinic's only retirement community, and we are in downtown Rochester, right on the north side of the Rochester campus. As you can see in the picture, we're a 22-story building. On the first floor, we have a fitness center, a resident service center, a chapel, a library, our corner cupboard, which is a place where people, residents and staff alike, can get something to eat and drink. The second, third, and fourth floor house our care areas. We have home health, we have an assisted living unit, on 3 different floors, a supportive living, which is our highest level of assisted living, and a skilled nursing facility, which some of you might know as a nursing home. 32 beds. That's the only place we take residents from the hospital, and we do therapy and different things for them there. Floors 5 through 21 are all people that live in independent living, and about 80 of them receive services from our home health agency, which only serves people within Charterhouse. And the 22nd floor, that is the favorite place to watch the fireworks on the 4th of July. It's also our Skyview dining room, which at this point is still the highest dining room in Rochester. I'm not sure when that'll change, but I'm guessing it will at some point. Pat, if we could go to the next slide. So we have lots of opportunities for careers here at Charterhouse. I am the Director of Health Services. If we can go back one more, please. And I oversee all the nursing staff, the RNs, the LPNs, the CNAs, the home health aides, trained medical assistants. We have MDS coordinator, all the nursing team. And one thing I would mention with the trained medication assistants is that's something that we have chosen for our CNAs that want to have that training to go back. Charterhouse pays for that. And like some of the other facilities, this is your first CNA position, we'll reimburse the cost for your training for the CNA as well. We also have fitness trainers. Most of these have a Bachelor of Science in Kinesiology, but they work with both our independent living residents as well as our Red Star care venues. And you can see that, we too, wearing masks, we're in the COVID world. We're very fortunate. We've not had any COVID in our care areas and very few among staff. So we've been very blessed. And my heart and thanks goes out to all of those out in our healthcare communities right now that are struggling with this. And thanks for all you're doing. Next slide, please. So it is a big building and there's lots of work to be done, which means we have additional opportunities. We have maintenance technicians. Maybe you're somebody that really likes to put things together or fix things. That's a great opportunity to get your foot in the door. Housekeeping, that's throughout the whole building. We have computer and IT support. Our seniors want to stay connected, and this time is even more important. They need to know how to use Zoom and FaceTime and all these different things to stay connected with their family. Our dining services aren't actually Mayo employees like the rest of the Charterhouse employees, but it is an opportunity to work here at Charterhouse with lots of positions from chefs, cooks, dietitians, and servers. So again, it's another great way to get in the door to Charterhouse and to experience our family here. We have recreational therapy, resident service center, and social work. They're part of our resident services team. The recreational therapists get to organize and coordinate all the activities for our residents, some for independent living and some on each of our care venues, assisted living, supportive living, and our short-term rehab unit. The resident service center, that's our front desk folks. So if you're a smiley, engaging, love to talk to people, take care of little things, kind of left and right, that'd be the place for you. And our social work team, we're fortunate to have a social worker in each of our care areas as well. And as you might well imagine, we have to have marketing, sales, and business and finance services as well. So we run the gamut of the careers that you can do here at Charterhouse. But bottom line, it is about our residents. This is their home. So we have the opportunity to be part of their lives. And for them, it's about life, living, and lifestyle. That's our administrator's mantra. So our residents are tuned in to IT. They take art classes, music. Outside of COVID times, we have parkside galleries and big dining events. We have dinners for our residents, lots of different things going on. Outings with our residents, the aides sign up, they get to go out to Ironwood Springs and things with our resident and have a day off campus and to do different things. So the opportunities are endless and it's fun. It's a joy to be part of their life and really interesting to hear the stories that they have to share. Next slide. Charterhouse is part of Mayo Clinic, so we have all the same benefits that Mayo Clinic has, but it is a privilege to serve our seniors. And as I mentioned, we are a community. Our residents and family, all of us feel like we're all one big family here at Charterhouse. I first stepped into Charterhouse about 4 years ago, and I knew immediately that this is a place that I would like to be. I knew it would be a place we could make a difference. Everything that we do here makes a difference for our residents day in and day out. It is Mayo Clinic's only senior living facility. We do have competitive salaries in our long-term care. We do have the shift differentials for evenings and nights. Mayo Clinic benefits, we've got the umbrella benefits, medical, 3 different options to choose from. Some of you that might be under 26 and still under mom and dad's healthcare plan may not be that important to you right now, but we also have a tuition reimbursement program. So if you are employed 0.5, which would be 5 8-hour shifts in a 2-week period, and been here for a year, you can get $3,000 per calendar year for tuition for undergraduate studies and $5,250 for graduate studies. So we do have paid time off for vacation and sick time. There's matching for your 403B, a lot of different opportunities to explore the different benefits. But growth is certainly one of the options. One of the success stories that I would share is we have a man by the name of Jason, who started as a CNA for us many years ago. He went on to get his RN degree. At that point, we weren't hiring nurses, new grads into the facility. That has changed now. We do hire new grads. So Jason went working other places. He did come back to Charterhouse. He was out and saw how lucky and what a privilege it is to work at Charterhouse, and chose to come back for work for us. And now actually he is our staff development coordinator. So the opportunities and to be able to see those opportunities and growth is just phenomenal. And he's doing a fabulous job. So there's so many different things you can do. And again, you could come in at the age of 16 and dining services. We do hire at 18 or above for our health services and CNA positions, but there really is so many different opportunities. But last but not least, we do have fun. This is a group of our staff, anybody from dining services, administration, our rec therapist, our fitness people. We have a talent show. We usually do a talent show every year that we put on. It can be residents and staff alike to participate. And it's just been a ton of fun. So we do find opportunities to have fun at work, and it's so important. Those are the things the residents are going to remember, and we do too. It's creating memories for all of us. So, and the last slide, yes, that is me. We do usually a Halloween bash and invite the community to come in for our kiddos in the community to come in, get candy, have a safe place to be, games and candy, all the fun. So Mr. and Mrs. Potato Head, I actually talked to our maintenance supervisor, Rich, and everybody was quite surprised I talked him into that, but we had a ton of fun. But my name, email, phone number is there. I'd love to answer questions that you might have. You can search Mayo Clinic jobs and search Charterhouse. You'll find positions. And if you're savvy and navigate the Mayo webpage, the Mayo job site, you can go to Careers, Health Professionals, and Senior Care and Services. And that's a very specific page for Charterhouse and all the job opportunities that we have for you. I am glad to take any questions. Thank you.
Wow, Charterhouse sounds like a very positive community to work in and live in.
It's a
And
delight to be here.
I saw this last slide that it was a fun place to work.
It is.
Yeah, but we do have one question. Could you explain again what Resident Service Center is and the staffing opportunities there?
Absolutely. Our resident service centers are front desk. So when you come in the front door, that's the first place you stop. So those are our staff that greet every resident or visitor or delivery that comes into Charterhouse. They answer phone calls from the residents to answer questions about programs or mail, or they are a jack of all trades and bar none, one of our most important teams here at Charterhouse. So if you like answering the phone, answering questions, being a problem solver, love interacting with people, it's a great position.
Wonderful. Thank you.
Thank you.
All right. Moving on, our last employer for today is Todd Rudos with Winona Health. Take it away, Todd.
Hi, Pat. Thank you so much for having us on. My name is Todd Brutus. I'm the Senior Human Resource Business Partner with Winona Health. And I've been with the company about 3 years, the organization, I should say, and really enjoy working here. So if we want to go on to the next slide. Small town healthcare. If anybody's familiar with Winona, it's a great little small town between the hills. I actually personally live in La Crosse, and I didn't know much about Winona until I got this position. and found out it's a really diverse and unique area to work and live. So it's a great location. We're established in 1894, over 125 years ago. We offer 80 different types of services, anything from cardiac rehabilitation and radiology to long-term care and women's health. We do have one individual who's been with us about 3 years, a gentleman that graduated from Winona State, who actually works in our cardiac rehab facility as a .2. He also is a CNA in our long-term care facility, and then also as a CNA in our inpatient care. So the ability to work in different departments is definitely there for us. Our mission statement is simple. We're devoted to improving the health and well-being of our family, friends, and neighbors. And you'll hear those terms a lot, working here, family, friends, and neighbors, because that's truly what we're all about. We've got a variety of different positions outside of the clinical areas. We do have housekeeping aides. We have part-time and full-time and casual on call. Same with food service workers, and then patient access reps as well. From a clinical standpoint, you'll see we've got a lot of different departments and a lot of different positions that are available. Our CNAs, we do carry CNAs both in MSP and Family Birth Center. In our ICU, Watkins is our our assisted living area. Lake Winona Manor is our long-term care facility, and Edith Miller Manor is also an assisted living area. And then from an LPN standpoint, we have a dialysis department that employs 5 different LPNs. I believe that we have a position open there right now. Women's health, podiatry, family med, internal med, Watkins, and Lake Winona Manor. And for RNs, we currently have openings in OR, in our Family Birth Center, ICU, internal med, and Lake Winona Manor. And this is just a snapshot of our website. If you go to this website, if you want to check all of our careers that we have, you'll see the careers button towards the right-hand side on the top. Yep. And we could go to the next page, and this will kind of show you how to link up to it. What I recommend when you go in here is just hit the search button. Don't type anything in this in the other categories, because what that's going to do is it's going to show you every single position that we have available. Then on the left-hand side, you can go down and you can narrow it down if you want long-term care, assisted living, or if you'd like to work in the hospital or the clinic areas. This is an example of a job description for our housekeeping aide. This one in particular is casual on call. You'll see the apply to job link at the bottom. So you would click on that. You have the ability to attach a resume, a cover letter, and anything else that you'd like to attach. Why do our employees love working at Winona Health? We've got just a couple testimonials in here of individuals. This is an RN in our dialysis department. I love working for Winona Health because we're really focused on the well-being and health of the entire community. And again, that term community comes up quite a bit here. Winona Health's commitment to the community was highlighted by their willingness to help Sauer during the COVID-19 outbreak. Some may know this, but another assisted living home in the Winona area here had a COVID-19 outbreak. We agreed to take on some of their patients just so they could get through that small crisis. And again, she finishes out, it feels good to be a part of an organization that would do that. And then I love working at Winona Health because the people are genuine, community focused, and loyal to one another and to our patients and residents. I love that people truly care about well-being of others. Winona Health is made up of 1,000 unique personalities and relationships today that reflects the mission of this organization that was first imagined 125 years ago. Grit and grace are 2 words that perfectly describe the people who come to work every day in service to others. Winona Health is a family of hardworking and compassionate souls, and I wouldn't want to be anywhere else. And this is not a picture of me. We figured we'd do a lot better if we didn't show my face on this presentation, but this is a young professional, Bailey Rye, who recently came aboard. She's a graduate of WSU. She graduated in 2 years, so we're very proud of her. She's handling a lot of our recruiting, and that's her contact information there. And I take any questions if anybody has any.
Anybody have questions for Todd at this point? I'm not seeing anything come in right at the moment.
Well, thank you for your time.
Yeah, appreciate you participating. And I want to thank all of our employers who presented today. And thank you very much to everyone who joined us today. I appreciate that too. If you want to follow up with each of these employers by contacting them, you will get a copy of this presentation, so you'll have their contact information. Another reminder, if you didn't get a chance to complete that attendance form at the beginning, you still could do that, or just type your name and the city you're from in the chat box so that we can give you credit for attending. For many more open positions, we just ask you to go within these sectors, go to careerforcemn.com and minnesotaworks.net. Many companies are hiring. We do have this calendar of events that is on careerforcemn.com that you can go and find other virtual career fairs that are coming up. In addition, you can follow us via social media on any of these, the Facebook, LinkedIn, Twitter, YouTubes. And to find a career force near you, if you search www.careerforcemn.com/locations, then you can find one in your area by just typing in your zip code, or you can feel free to contact either Victoria Tiff in Rochester, or me here in Winona, or the general contact information or general email address is our Career Force Winona, which is on this page also. Thank you again to all employers and job seekers for attending today's event. And this concludes today's virtual career fair. Thank you again.